Hi everyone, my name is Dr. Bridget Muller, and I'm pleased to be hosting today's conversation as we officially welcome Dr. Tim, who is the newly appointed Executive Director of Africa Digital Health Network. Dr. Tim, congratulations.
Thank you so much. Happy to be here and as I take on the new challenge. Yeah.
Amazing.
Yeah.
So I want to start with the first question, which is probably not super obvious, but I've been wondering, how does a dentist end up in ADHN? Can you tell us how your journey, the whole trajectory has been?
I think it's been a journey of many firsts, if I may say for myself. And I started off as a dentist in Nairobi, set up a practice that's still continuing.
Yes.
Easily one of the biggest in the city. From there, I joined the Kenya Dental Association, where I believe most of my leadership was honed.
How do you see ADHN in the next 5 years?
I think our dot in the horizon as ADHN is we need to be the unsung hero in Africa's story. What do I mean by that? I mean that when we measure progress of any society, we look at how society treats its most vulnerable.
Yes.
And we have very many vulnerable people in the continent.
That's true.
Success for me would look like that the people who do not know ADHN exists would say we have had a benefit because one of ADHN's members has brought a solution that has made life easier for us. All right, and here it's not the pomp and color.
Yeah.
It's those small and soft stories that are told and people say, ever since this solution was introduced, my life is better.
That's true.
I'm healthier. Solutions are coming to me faster. There's this predictability as well of what I am seeking, and I do want those solutions to be delivered by my members.
Yeah.
That is what I look at success like. ADHN will be a digital dashboard in a car. All right. The reason I say that is when the car was invented, we didn't have a dashboard. Certainly, right? We had a few gauges that showed important things, but now we do have cars that have a screen from one door to the next.
Yes.
That is ADHN.
Okay. And it keeps on evolving.
Amazing. So ADHN must keep its screens clear. It must keep its information crisp. It must keep its information relevant, so that when the drivers of healthcare, who are the inventors behind us, who are the governments, and ultimately the people of Africa, look at us, they can say that we are doing a good job.
Amazing.
Yeah.
I don't know about you, but I feel quite reassured having Dr. Tim steering ADHN for the next couple of years. I'd like you to give a call to action to your new members who are going to come on board on joining you.
One is ADHN cannot do this alone.
True.
I cannot do this alone. We have a fantastic board, certainly. They've been men and women who've carried the vision up to where we are now.
Yes.
And as I join them in driving the ADHN vision and agenda, we do need everyone on board. We do need the communities on board. We do need our governments on board. We do need the private sector on board. We need people in academia, people in research and development. We need the youth on board, and certainly we need the women on board. And my call to action for all of us is for us to deliver healthcare for a quarter of the world's population. It cannot be done any other way at scale other than using digital health solutions. So that's why ADHN is important, and that's why the course that we are embarking on is certainly important, but it will be meaningful if we do it all together.